It's flu season, and while most everyone is used to the idea of a flu shot, 2020 brings with it the added component of COVID-19 to our seasonal concerns. Family nurse practitioner Theresa Gardner from the St. Regis Mohawk Health Services explains the importance of the flu shot, especially this season, along with information on drive-up testing that will be available.
The flu shot can actually be given anytime at the clinic. If you have an appointment coming up, please remind your nurse or your provider to give you a flu shot. You can also come to outreach and we will give you a shot in our department anytime. We have flu pods that are coming up and they will be starting October 15th, and that will be at the IGA, and it will be from 9 to 5. We have one on the 20th and the 22nd at the IGA, the same hours, 9 to 5.
Seniors and people with weakened immune systems are especially susceptible to the flu. And this year there are some special flu shots for people 65 of age and older.
The other thing this year is that we have the regular flu shot for people under 65. People over 65, we have a higher dose one that's better for seniors. So we're recommending that for anybody over 65 years of age. The flu shot is really important that we get it every year. It's only good for 6 months. So I always try to get my patients to say, let's do it from October until we want to cover April and part of May. That's our goal. People that have gotten flu shots for 10 years in a row, that they have more immunity than anybody else. So
some people have a fear of the flu shot for any number of reasons, Gardner stated. But this year it's especially important to have the shot so that medical experts can diagnose a patient correctly if they start to become symptomatic. Gardner explains.
COVID, unfortunately, there's no treatment for, so we're just going to treat it symptomatically. Think about it. This year particularly is a rough year. If you get the flu shot, that's going to help us differentiate, is this COVID or is this flu? Because with the flu shot, you should not get sick. And I know a lot of people will say, I got sick when I took the flu shot. But what they say is that you might have been coming down with a cold at that time. The flu shot goes in and it's helping your immune system to build up antibodies to prevent you from getting the flu. So I think this year it's particularly important that you do get a flu shot.
So this year, getting a flu shot is more important than ever, and Mohawk Health Services makes it easy to achieve. Gardner remarked on how you can have both a flu shot and a COVID test for free if you live or work in Akwesasne.
And that's what we're going to be dealing with this year is this the flu or is this COVID? I think that the clinic has been very diligent in what we've done for COVID, and we'll do the same for flu. And it's just about taking care of everybody in the community, you know, the well and the sick. We're actually going to treat the whole community. So if you work in the community and you're not native, you can still come to the flu clinic and get your flu shot. Tribe has taken on that, same with COVID testing. If you work in the community, you can have a COVID test.